Having talked about the approval and use of CAR T cell therapy for late relapses, few words about the clinical trials exploring role of CAR T cell therapy for earlier relapses. KarMMa-3 is actually a phase 3 trial that evaluated ide-cel CAR T cell therapy and compared it with standard of care chemotherapy for patients with earlier relapses, as early as their third relapse. And in this particular trial, CAR T cell therapy was found to be more effective than traditional chemotherapy, with 70% of the patients responding to CAR T versus 40% of the patients responding to chemotherapy. Similarly, the progression-free survival, or how long the CAR T worked for, was nearly 12 months for CAR T patients and less than 6 months for patients who received chemotherapy. There is an emerging role of CAR T cell therapy in the earlier lines of therapy. CAR T cell therapy is currently being explored in clinical trials in as early as first line of therapy, where patients who have high-risk myeloma, instead of receiving transplant, are actually receiving CAR T cell therapy. Similarly, for patients who actually fail to achieve a good response to transplant, are receiving CAR T cell therapy as consolidative therapy at 3 months after transplant. Similarly, patients who actually relapse within a year and a half of their transplant, a biologically aggressive and high-risk disease feature, are receiving CAR T cell therapy as well as salvage treatment. So clearly, the field is moving in a direction where CAR T cell therapy is being tested and perhaps will become available in the earlier lines of treatment.